Good afternoon, everyone. My name is Kate Miller. I'm the CEO of BirdLife Australia, and I'll be your MC for today. Thank you so much for joining this webinar. It's titled H5N1 Bird Flu and Australian Wildlife. We've had an extraordinary level of interest in the events, and I thank everyone for making the time to attend today. I'd really like to start by acknowledging the First Peoples of the lands and waters of Australia and pay respects to elders past, present and future, and express my deep gratitude for the long and ongoing custodianship of country. I'm actually here in Naarm on the lands of the Wurundjeri Woi-wurrung people of the Kulin Nation, and I pay my respects. I ask everyone actually to acknowledge the lands that you're meeting on in our Q&A section. It's always great just to really understand and have our feet firmly planted in that acknowledgement. It's also NAIDOC Week, and this year we're celebrating 50 years of Deadly, which is fantastic. So absolutely paying my respects to any elders and First Nations people attending the webinar. And I have to say it's an absolute honour and privilege to have Shandell Cummings, a Menang woman from WA, as part of our panel today. Last week, I was actually really lucky to travel over to Western Australia and down to Esperance, where, as many people on this call will know, is where those first two birds were retrieved from Cape Le Grand on the 14th of June. It's hard to believe it's now 3 weeks since those first birds were retrieved and brought in and tested, and the clock is now ticking. The work to upscale wildlife resilience is urgent, and susceptible populations of wildlife are going to need all the help they can get. And specifically, we need our wildlife populations to be given every opportunity to build the resilience they need ahead of any future outbreaks. And we should absolutely be doing all we can to make sure that the breeding seasons ahead of us are successful and habitat areas are safe and well protected. The healthier the populations and the better the condition of the habitat, the better chance these populations are going to have of weathering this storm and recovering from the impact of H5N1 bird flu. The converse is also true. The international research shows us that where you have stressed, diseased wildlife in fragmented habitats, interacting with cities and agriculture, the negative impacts and consequences are far greater. Everyday Australians that I speak to and who have been speaking to me are expecting absolutely governments to act now, and that for there to be a really true and constructive role with community and with industry to build wildlife resilience, and for that to happen now and not leaving it until the disease is spreading. So today, you're going to hear from some of the leading scientific and Indigenous experts on this topic, as well as the leading conservation groups, about what we know about bird flu, the risk it poses to Australian wildlife, and most importantly, what needs to be done right now to mobilise action. I'm so pleased to introduce our first speaker, the wonderful Dr. Michelle Villa. Many of you will have seen her. She's an absolute gun on this topic of H5 bird flu, and her topic is just really explaining the scale of the threat and what we do know about H5N1. Dr. Michelle Villa is an ARC Future Fellow at the Uni of Melbourne Doherty's Institute. She's researched the ecology and evolution of avian influenza in Australian wild birds and has contributed substantially, and that is no understatement, to Australia's preparedness and response around this highly pathogenic avian influenza, including what we need to be doing on surveillance. So I'm just going to pass you over now to Michelle.
Thanks, everybody. So my role in this webinar today is just to do a little introduction about what avian influenza is and how we got here, and to highlight what has happened overseas in terms of the impact of this virus on wildlife. So next slide, please. So what is avian influenza? So I put a little figure there on the left. Avian influenza are all the avian strains of influenza A virus. And if you have a look at the little virus, there's two different lollipops that stick on the outside. They're called the HA and the NA. Now, these viruses are extremely ancient, which means they're very diverse. And so in birds, there are 17 different HAs, 9 different NAs, and they love to mix and match. Next, please. So when we go out and we do our surveillance for avian influenza, we actually find an enormous diversity of these H5N1 combinations. Next, please. However, when we generally do our surveillance in Australia and overseas, what we find are low pathogenicity avian influenza viruses. So all these 144 different combinations, they don't cause any disease in the wild birds that we find them in. They're common in waterfowl. So I did my PhD in Sweden, and on any given day in the autumn, 20% of the mallards would have one of these viruses, and those ducks are just doing their regular ducky things. As I said, these viruses are probably very ancient, such that they have likely been in birds since birds have been birds. Now, it's not these viruses that we're here to talk about today. It's about high pathogenicity avian influenza viruses. Next, please. And so how did we get here? So it was the year 1996, and we had one of these low pathogenicity H5N1 viruses, so an H5N1 that doesn't cause disease, in poultry, and this virus evolved. Next, please. And so what we ended up with was a virus that transitioned from one that didn't really cause disease to one that really caused disease. This new H5N1, this high pathogenicity H5N1, this caused high morbidity, so sickness and mortality in poultry. Huge proportions of poultry that were infected died from it. And in the few occasions that it went into wildlife, it was the same. Wildlife became really sick and wildlife died from this. Now, in 1996, this was not the only time one of these very nasty viruses emerged. You'll actually remember that in the southeast of Australia in 2024, we actually had bird flu caused by high pathogenicity H7 viruses. So from time to time, these low path viruses that don't cause disease do jump into poultry and evolve into these really virulent viruses. Now back to our 1996 story. So after the evolution of these viruses in 1996, next please, these high path H5 viruses became endemic in poultry in some parts of the world. And as they circulated in poultry, they were never eradicated. And with that comes evolution. And so the same way we saw in the COVID pandemic that all these different variants emerged, we now have a huge number of variants that have emerged of this H5N1 high pathogenicity avian influenza. So the variant we're here to talk about today is this one called 2344B. I realize the influenza people are a bit rude. They could have at least tried to give it nicer names like Alpha, Delta, and Omicron, but we are doing this horrible letter number situation. But I just want to remind you that in addition to this 2344B, this virus that we're talking about, there are other variants that circulate, and they circulate in Asia in present day. So before the emergence of this 2344B variant, if we look at what the epidemiology of these other H5N1 variants, what we generally found was a virus that sticks to chickens like glue. It's endemic in chickens, it would circulate in chickens. In poultry that were vaccinated, the chickens wouldn't get sick, and so it just got sustained. And these viruses almost never jumped out of chickens into wild birds, and the few occasions that they did, it ended up being self-limiting, so it just stopped. But when this 2344B variant emerged, the whole situation changed. So now we have a virus that does well in chickens. We've got a virus that is reservoir in wild birds, one that's reservoir in some mammals, including seals and cows, and from there spilling over into a huge diversity of other animals, which has really led us to the global pandemic or animal pandemic that we're in. Next, please. So the next slide here is just to show you notification data, so where this virus is found. And I've just overlaid on it some arrows to show you some key events. So this 2344B variant that we're dealing with really emerged in Europe as the epicenter in about 2020, and from there it spread around the globe. So 1 year later into North America, 1 year later into South America, 1 year later into the subantarctic, 1 year later, long distance spread in the subantarctic, and recently arrival into Australia. So as this virus has traveled around the world, it's been really catastrophic for wildlife. So at a really high level, if we have a look in birds, it has affected more than 400 species. It's mostly really impacted water birds, so things like ducks, gulls, terns, as well as seabirds, gannets, which I'll talk about in a minute, and predatory and scavenging birds, so think eagles and vultures. It's also impacted a wide diversity of mammals. Other than the cattle and the seals, it's mostly affected scavenging and predatory mammals, which is not hard to imagine. So if you're a little fox and you come across lots and lots of dead birds, that's an all-day buffet. And unfortunately, the little fox is being infected by his behavior. Now, it's not just this high level number of animal or diversity of species that have been impacted. We're actually seeing species level consequences. And I just wanted to share with you two case studies. So the first one is northern gannets. So here in Australia, we have Australasian gannets. They're really beautiful. I live in Melbourne. You can go see these guys in Pope's Eye or Portland. They're super cool. In the North Atlantic, there is a species called northern gannets, and this species was affected by avian influenza in 2022. Some really incredible work done by Jana Jaglinski and Jude Lane has shown that if you look at population counts before 2022 and after 2022, that somewhere between 25 and 38% of this species has disappeared, which is an enormous number of individuals to die in 1 year. And furthermore, if everything goes well, it will take 19 years for this species to recover. In mammals, we have another example from South American sea lions. During 2023, this virus spread through South America and was being transmitted from marine mammal to marine mammal. Again, looking at data from before versus after the outbreaks, there has been a species level decrease of 17% in South American sea lions and 31% in Southern American fur seals. So this virus is having really catastrophic impacts on these birds and on these animals. I know this talk is about wildlife, but I just also want to remind you that it's not just wildlife that are being impacted. We've seen enormous impacts in poultry and in the US in dairy cattle. There have also been human cases, of course. Next, please. However, in all instances, the risk to the general population remains low, and that's based on assessments done by WHO, WO, and FAO, as well as the Australian CDC. So just to wrap this up, I think you've probably heard a lot of this messaging lately: avoid, record, report. Everyone here is a really critical part of the response. So if you see any sick or dead wild birds or marine mammals, it's really important that you please call the Emergency Animal Disease Hotline. Thank you.
Thank you so much, Michelle. Just seeing those that global perspective is just such an important set of context here. And I know as soon as yes, those detections were done in those subantarctic islands, you know, we just knew it was just that one step closer. So thank you so much for that fantastic context and just reminding us about those key messages of avoid, record, report. So we're going to move us along now to wonderful Dr. Tiggy Grillo. So Tiggy is going to speak to us about H5N1 bird flu in Australia and what is being done. Dr. Tiggy is the National Coordinator and Chief Operating Officer of Wildlife Health Australia. We've had a lot to do with Tiggy, and where she's been really working really tirelessly for the last 15 years to connect people through really positive and mutually beneficial partners to advance both wildlife health. And if you haven't heard about it, you're going to certainly hear about it now, I'm sure, the One Health concept, which is really all about a healthier future for all. Thanks very much, Tiggy.
Thank you very much, Kate, and thank you for having me. So I, as Kate said, I am dialing in from Tasmania, and I'm the Chief Operating Officer of Wildlife Health Australia. I also hold a couple of other hats. So I'm also Australia's World Organisation for Animal Health focal point for wildlife. So I support Australian reporting internationally, and I also co-chair the IUCN SSC Wildlife Health Specialist Group. Next slide, please. So I'd just like to acknowledge the land on which I'm dialing in from, which is Nipaluna country in Tasmania, and acknowledge the traditional owners of the land on which I work and enjoy nature. Next slide, please. So I thought I'd just start, and Kate's sort of alluded to this already. Wildlife Health Australia is a national body. We advance the health of wildlife, predominantly for the health of all, because we're all interconnected. And Michelle alluded to this in her previous slide, noting that H5 bird flu is impacting not only wildlife, but also poultry and can impact humans, although noting that the risk is very low. And as part of our work, we've been managing the National Avian Influenza Wild Bird Surveillance Programme for over 20 years in partnerships with many others, including BirdLife Australia and Michelle herself. But we've also been developing H5 bird flu preparedness information for a number of years, since 2022. And you can find that information on our resource centre. Obviously, with the recent detections, that's led to some changes within the organisation. That has included implementing our incident support system, and we've activated that to ensure that we can maintain our support for the incident response. So we support not only the national coordination of the response, but also the jurisdictional response where we can. And that really includes providing intelligence and networking to key people and organizations, as well as information and communication. So we've been updating a number of our resources on our bird flu resource page, and we'll continue to do that as the event progresses. Next slide, please. So today I was going to talk about why we're preparing for bird flu. Well, from what Michelle has demonstrated in her slide, we've learned over the last 5 or more years about the impacts of H5 bird flu on wildlife. And that international experience has really highlighted that planning and preparedness is crucial to support a soft landing for H5 bird flu here in Australia. And that preparedness extends beyond just the response. It talks about raising awareness through that avoid, record, report messaging, planning, training, doing surveillance, but also detailing operational plans. And in recognising that need, the Australian government dedicated $100 million a couple of years ago to support that preparedness action through multiple agencies and organisations, really highlighting that One Health approach, ensuring that environment, health and agriculture were working hand in glove together, and identifying mechanisms where we can interact with key people on the ground to support those preparedness actions. In particular, the Department of Environment, Energy and Water has invested $47 million to help protect Australia's most at-risk species in important natural places, using the best available science and evidence here in Australia, but also from overseas. And so I'll walk through some of the things that have happened in the last few years. Next slide, please. So as part of preparing, we really need to identify what the species are that are at risk. And as Michelle identified in her work, and the work that she demonstrated in her slides actually informs a tool that was created a number of years ago in collaboration with Deakin University and BirdLife Australia to really understand what species were susceptible to infection. And when they're susceptible to infection, that could mean that they could become a reservoir and perhaps spread the disease, but more importantly, they could become sick and die. And so that tool really highlights the species that are susceptible. Then the Commonwealth and jurisdictional biodiversity preparedness has also meant that we should put together that species susceptibility with species vulnerability. And H5 bird flu risk analysis was co-developed with partners from BirdLife as well as Charles Darwin University to really help understand the risks not only to Australia's bird, but also to Australia's mammals. And that looked at not only that susceptibility element in relation to their ability to be infected and then potentially become sick and die, but also about their vulnerability in terms of, was the species already at risk of extinction? Well, they're probably a higher priority species that we need to focus on. And so that analysis really helps us to predict and identify the key at-risk species and prioritize species and site planning. And where 2 species or more cohabitate in a particular area, then that can identify a specific site that's going to be really priority for us. That tool will then continue to be updated as new information comes to light, recognizing it's building on international experience, but also acknowledging that the Australian context is very unique in terms of our environment and our ecosystems. So through that preparedness planning, there have been plans to protect both sites and species ongoing across Australia. And those are certainly planning documents that are living documents. They interact with the broader H5 bird flu planning within each state and territory to ensure that they can implement an effective cross-agency response to the detection of bird flu within their jurisdictions, whilst also interacting with the national mechanism for coordination for a response. So what might a response plan look like? Well, some of the actions that are undertaken include enhanced surveillance, for example, looking at both healthy birds, but also monitoring for wildlife mortality. And that avoid, record, report is really important at this point, so we can find new detections and determine how we respond to those new detections. But site and population-specific strategies can also be really important, and they're based on local risk assessments, and they could be anything from restricting access or activities to enhancing biosecurity measures, such as washing boots before moving between sites, potentially euthanasia, or removal of carcasses, and vaccination. And I'll talk a little bit about vaccination in a bit. It won't include habitat removal. So these plans are underpinned by a number of national documents, including preparedness documents, which we published in 2023 to help people, wildlife managers and wildlife care providers really prepare for bird flu in advance, as well as guidance for response plans in the event of an outbreak in wildlife, in addition to human health guidance to help ensure that your workers are safe on the ground. So, for example, in South Australia, there are a number of activities underway to really ensure that those site and species-specific plans are tailored to the context of South Australia, and that includes ensuring a soft landing for H5 bird flu, for example, through habitat restoration, and feral bird, fox, and cat control as an example. So vaccination of wildlife comes up quite a lot, and it's something that I thought I'd quickly unpack. There's an Animal Health Committee policy and guidance document, and that really highlights that any decision to vaccinate rare, protected, and valuable birds will be made by the appropriate Commonwealth as well as state and territory authorization authorities and informed by the available science and evidence. There is an Australian Pesticides and Veterinary Medicine Authority permit for vaccination of rare and protected birds in Australia, and any vaccination of birds will need to conform to that permit as well as the policy. And if used, vaccination will most likely be used to protect species held in captive breeding facilities and potentially in specific situations. Next slide, please. Other activities that have occurred in the space of preparedness has included communication, and that's involved many of the organizations speaking today. And some of the activities that we've also been involved in is creating opportunities for First Nations people to come together and talk about bird flu. So I just wanted to acknowledge the great work that was undertaken by the Armidale Local Land Council for helping us do that. And just to note where some resources are, but the key message here, I think, and what Michelle ended on is avoid, record, report. And thank you very much.
Thanks so much, Tiggy. And I did love having that slide with wildlife resilience, good general health, reduce crowding and stress, protect habitat. They're really common themes that we're seeing emerging from all the presentations. Fantastic. All right, we're going to move on, and I already acknowledged it's such a privilege to have Shandell with us today. So the topic is cultural, spiritual and physical risks for bird flu on First Peoples. Shandell Cummings is a Menang woman from WA and a practicing First Nations artist. At the University of Western Australia, she's a lecturer of Aboriginal knowledges, where she researches Indigenous-led conservation, traditional ecological knowledge, and two-way science approaches. Thank you so much, Shandell.
Well, Cardiac, and thank you for inviting us to share a little bit about our culture with you guys. As stated, my name is Shandell Cummings. I'm a Mirraninga Yorga, so I'm connected to the south coast of WA. Although my strongest connection is technically in the western part of the region. So we sort of know that this incident has sort of really occurred on the eastern end of this region. I'm definitely not an expert in H5N1 for sure, but I can talk a little bit to the cultural impact that this incident could have for Aboriginal communities, especially across the south coast of WA. And I've been invited by some elders in our community to do that. Firstly, I would like to acknowledge my elders, past and present. They have paved the way for us in caring for country and ensuring that we are, involved in issues such as this. Definitely across Menang, Goreng and Wujari, Buja, or country that's connected to the south coast. I also like to extend that gratitude to all of our Aboriginal communities and elders across Australia. And I know that there will be some of you that are listening today. So, keep up the good work. I think from a not being an expert within this particular topic, I can talk a little bit to the cultural impacts. And so from a cultural perspective, we feel that Aboriginal people are at risk with events such as this, especially from a cultural perspective, a spiritual perspective, and a physical perspective as well. I think to sort of explain how the physical impact occurs is because as Aboriginal communities across the South Coast, and I'm sure this would apply globally, not just here, we, as Aboriginal communities, we still heavily rely on wildlife as a food source. So incidences such as this really could put that at risk, ensuring that we have access to food resources, which is, a big part of our communities. I think that's probably a really important thing to note. Then if we think about it from a spiritual perspective as well, most of Aboriginal communities across Australia, have this inherent need to care for country and everything within it. So that includes BirdLife especially. The idea of Aboriginal people also utilising, a lot of wildlife as food resources means that there is potential that we then become first responders in incidences such as this. So finding birds, especially along the coast, and how that process needs to be dealt with. I think there's a real role for Aboriginal communities across Australia to be involved in this process. When we also look at our cultural and spiritual perspective, we can also think about culturally significant entities, which are a key species across Australia, not just to us, but culturally significant entities are very important because they are actually also part of our totemic systems. And birds in particular actually equate higher within that hierarchical system. So most communities, have a very strong connection to CSEs, or culturally significant entities, and totemic species. So I think from that perspective as well, it also makes sense that we do ensure that Aboriginal people are engaged or meaningfully engaged and actually supporting the response to H5N1 purely based on the facts that I've just talked about. I think it really does make sense to actually pursue avenues of a potential workforce, especially with a lot of these things being critically under-resourced as well. So looking at a potential workforce that are also can be identified as first respondents in some incidences, such as ranger programs, especially along the coastal regions or the south coast of WA. It is critical, or it can become a critical component, because it's also about supporting cultural healing while Aboriginal people or Aboriginal communities, especially within ranger programs, are actually also being upskilled. And I think with that upskilling, there's also this added bonus of actually developing relationships, for future events, if this were to ever happen again, or other similar sorts of events. At the end of the day, I think it's really important to note that we've seen a lot of this stuff happening already across the globe. There's not a lot of information out there about the cultural impacts or the cultural inclusion, but I think it's critical that we are invited to become key stakeholders within processes such as this, because I think that if you don't have the cultural story, then you're actually missing a critical element of protection and ensuring that there's an ongoing process which actually strengthens the response. And I think lastly, I would probably like to note that this not only applies to Australian Aboriginal peoples. I think it should be something that should have been considered on a global scale, which I'm probably sure it is. It'll be nice to see if there's some complementary actions or agreements that can actually be implemented within dealing with this as well. The totemic species are very significant, along with cultural significant entities. So, yeah, it will be great to actually see a heavy or high cultural inclusion within the program. Thank you.
Thanks so much, Sheldon. And again, just resonating so much when I was down in Esperance with Dr. Lyndall Kidd, and we were out and we had the privilege to spend some time with the Jaldarak Indigenous Rangers, and it had been a program where we'd been helping with some shorebird monitoring. And just listening, and they'd requested to be part of the IMT, and it was still a question mark, like, was that going to be considered? I think that's still at play right now.
Yeah.
But just thinking about, those culturally significant species, like we've got our threatened species or our susceptible species, but it's just a whole nother critical lens. And they were talking about even the active surveillance, where we're looking in national parks or we're looking where threatened species, but it's other parts of the landscape that are culturally significant, which is where those Indigenous rangers, who are incredibly skilled and knowledgeable, should be leading the way, and then bringing that all back to the table to decide what's next and be part of the decision-making structures. So just fantastic explanation of what this might mean for First Peoples. Thank you so much, Shandal. That's been fantastic. But I'm going to keep this show on the road and going to hand over to, yes, Dale and I, we are twins. We've got matching backgrounds. Wonderful Dale Wright from BirdLife Australia. So his topic is about, not surprisingly, the risk to native birds, but also what's needed to mobilise support. Dale has worked in biodiversity conservation in Africa and Australia, including managing a large protected area complex in Tanzania and implementing the Important Bird Areas program in South Africa, and more recently as an environmental consultant, supporting nature positive assessments and teaching and research in environmental science. We are so lucky he's decided to come and call Australia his next place of residence, and did a fantastic PhD, and he currently oversees BirdLife Australia's Science and Priority Landscapes program. Over to you, Dale.
Thanks very much, Kate. I want to firstly acknowledge the lands of the Wurundjeri people where I am today, and also start by acknowledging that I'm speaking today on behalf of our team at BirdLife Australia and presenting the great work of my colleagues Chris Purnell, Grania Maguire, Tanya Lewis, Lyndall Wilson, and many others. So BirdLife Australia has played a major role in the conservation and monitoring of Australian birds throughout our 125-year history. It's our birthday this year. And since 2021, BirdLife has had representatives sat on the National Avian Influenza Wild Bird Steering Group, and we established a dedicated avian influenza response coordinator in 2024, and continue to work with multiple jurisdictions, communities, the federal government, Wildlife Health Australia, academics, and many other partners. Now, since the incursion started about 3 weeks ago, our team has been drawn in to support the response. Our role has included providing scientific expertise, mobilizing our tools, advocacy work alongside our partners here, and community mobilization, which is preparing our staff and volunteers to assist and helping to share important messages through our broad network. Next slide, please. Today, I want to highlight two of our tools that are critical for informing the response. Now, we recently worked with various partners, indicated on the slide there, on a preparedness tool for health, poultry, and conservation practitioners, which is now known as AviFluMap. Now, AviFluMap highlights migratory shorebird, waterbird, and seabird congregatory sites, those sites with 5,000 birds or more across Australia. It also maps migration pathways for these birds and has mapped the global spread of this disease. So that tool is live. It's available now online. Just this morning, in fact, our team was supporting state government agencies to apply this tool and our expertise to help with their surveillance responses. So I encourage you to take a look at that. Next slide, please. I'll now expand slightly on the description that Tiggy provided of the soon-to-be-released bird flu susceptibility analysis developed in partnership with the federal government departments indicated and led by Chris Pennell and Professor John Winarski. The tool has been developed to inform 3 main areas where we felt we require additional ecological context to help us plan preparedness. Now, that information, that context, includes predicting establishment and arrival pathways, mapping transmission pathways on the continent after the virus has arrived, and also identifying the most at-risk species and sites. In this tool, BirdLife supported the analysis across 1,700 taxa, bird species and populations, and the risk score developed is a combination, as Tiggy mentioned, of susceptibility ranking and vulnerability considerations. Next slide, please. The susceptibility scores take into account ecological variables, which try and help us to determine what is the likelihood that a bird is going to come into contact with the virus, i.e. that it will encounter it, and their likelihood of succumbing to it. So that is, even if they are exposed, are they able to catch it? And if they do catch it, will they die? So that sort of rounds off susceptibility, which is also affected by other ecological variables, such as whether the species is a scavenger or not, for example. Next slide, please. The other important component of this analysis is the vulnerability scores. And in vulnerability, we consider things such as EPBC threat status, current threatening pressures a species might be facing, or if that species is already in decline. This score is also sensitive to a bird's range size, and if the life history of that species includes time where the bird congregates together in large numbers, for example, to breed, feed, or roost, and that might also elevate risk. And so, for example, a bird like the Christmas Island frigate bird featured there has a very large geographic range, but all individuals breed in one place, and so that significantly increases its vulnerability. Next slide, please. So here I just provide some examples of how different species are considered in that analysis. In the first example, we have the Alligator River yellow chat, a subspecies of yellow chat, which is an incredibly small and restricted population. Animation, please. But it occurs on a couple of floodplains, only a few floodplains in the small isolation, which are also home to hundreds of thousands of water birds. Next animation, please. So the second example there is the white-bellied sea eagle. And this is also at risk because it coexists with large waterbird populations. So it also hunts scavengers, dead and dying waterbirds. And although it's widely distributed, it has several threatened breeding populations in the southern part of Australia. An animation, please. We saw very significant impacts on a similar species, the bald eagle, when the virus moved through the United States. And next animation, please. Our last example here is the southeastern red-tailed black cockatoo. It has low susceptibility. It's not a water bird, it's not a scavenger or predator, and it doesn't have high-density aggregations. However, it has very range-restricted geography, particularly during its breeding season. And it may flock together at times, and it's known to occupy agricultural landscapes. And so those factors, again, can be something that elevates the risk of that bird. So really, these examples serve to highlight the different interactions and different factors that we apply when we're assessing risk. And I'd like to lead you to keep a lookout for the release, hopefully soon, of this work from our partners at the federal government. Next slide, please. The whims of nature and this disease, with the arrival of only isolated cases of sick pelagic seabirds thus far, has given us what I consider to be a critical window in which Australia's preparedness and response can be tested, refined, and ultimately improved. Our response is going to need to be flexible, given the variability of the impact we've seen overseas and the uniqueness of our species and how they interact with the landscape. For example, we have very sporadic movements of our nomadic waterfowl as they respond to resources, which makes something like this very difficult to predict. We need the public sharing of operational plans. Conservation NGOs, local land care groups, and the public need to see these plans so that we can better understand the response and ensure our alignment with those plans. And we also need rapid, place-based plans for priority sites and species to guide interventions for wildlife resilience. Next slide, please. At BirdLife, we know from our current work on ferry tern conservation at the Murray River mouth and the Coorong Beach, in partnership with the Yarlurrui Rangers and other partners, that tangible actions such as installing exclusion fences, conducting behavior change programs and installing signage, or deploying fox baits, can all have tangible impacts on bird fledgling survival, thereby improving populations and the long-term resilience of threatened bird species. Now, there are many examples of similar conservation actions that could be deployed immediately by us and others that could measurably improve outcomes for threatened species. Next slide, please. So as Michelle flagged, whilst our focus remains on Australia's wildlife, we are of course concerned about the spillover and the One Health impacts, or combined social and economic impacts which this disease could have on our nation. The tangible, practical examples of resilience actions for our wildlife are not too late, nor too visionary to be implemented. We know the species that need help, and we know the actions that can be taken. So I put it to our conservation community to consider what actions your organisation could be taking to respond and further prepare, and we call on government to support this response across our multiple partners. BirdLife will, of course, continue advocating for healthier bird populations, informed communities, and continue building the right tools that can better prepare us to respond. We cannot vaccinate millions of wild birds, nor can we alter the wind currents that might bring migratory vectors to our shores. But we can control how quickly we detect the virus, how fast we clear infected carcasses to stop the scavenger cycle, and how effectively we mobilize millions of eyes on the ground around Australia. This is an unpredictable ecological emergency, but with radical transparency, better tools, and a united community, we can give our native birds their best chance to weather the storm. Thank you.
So much, Dale. Couldn't have said it better myself. I don't think I even need to summarise. Fantastic presentation, and we've got 2 more to go. So it is now my great pleasure actually to introduce one of our another fantastic collaborator, Alexia Wellbeloved from AMCS, and her topic today this afternoon is risk to native mammals and other wildlife, and what's really again needed to mobilise support. Alexia is the campaigns director at the Australian Marine Conservation Society. I'm sure she's known to many of you. She's worked in the environment and marine conservation area for over 25 years, both in the UK and here in Australia. And for over a decade, she's been such a staunch champion for stronger environmental laws, and included helping getting Places You Love Alliance up and running, and has been absolutely relentless in raising the bar for nature through everything she works with. So over to you, Alexia.
Thank you, Kate, and thank you, everyone. Next slide, please. So yes, I'm from the Australian Marine Conservation Society. We are a national science-based advocacy organisation, and as it says here, we are the guardian and voice for our oceans, coasts and marine life. So the issue and the threat of bird flu is very close to our hearts, so I'm pleased to be here today talking from Camaragal lands of the Eora Nation. In this talk, whilst I'll be talking about mammals more generally, I will have a focus on marine mammals, as this is obviously the focus that you would expect from me. Next slide, thank you. So in the past weeks and particularly years when I've spoken about bird flu and marine mammals, many people have said to me, but why are you talking about marine mammals? You know, this is the bird flu, surely it only applies to birds. So, you know, what I'm going to talk to you about today is to explain why this isn't the case. Even though H5N1 expansion started really happening in 2021, its presence has been detected in a huge range of mammal species since 2003, generating concern as its adaptation, as Michelle's slide earlier showed, to mammals implies a really important threat to wild mammal species worldwide. And in December 2025, the UN and the United Nations estimated that H5N1 had infected some 598 bird species and 102 mammal species. And it really, we think that these environmental changes that are fueling the spread of H5N1 in wildlife worldwide you know, are a real cause, with recorded spillover effect from birds to mammals, including to cetaceans and pinnipeds, the seals and sea lions. It's really important to note that this research and understanding, or this transmission, is still underway, and we don't fully understand it all, but you know, I'm here today to share what we do know. And what the data supports is that, as well as bird to mammal transmission, there has been mammal to mammal transmission and occasional mammal to bird spillover of H5N1 viruses in mammals worldwide. And scientists are concerned that H5N1 viruses are becoming more evolutionarily flexible and adapting to mammals in new ways, which could have global consequences for wildlife, humans, and or livestock has been covered. And I think that map that Michelle put up earlier shows the spread, and I'll talk to that more as well. Really, worldwide, bird flu has been devastating for mammals, and particularly marine mammals. And until recently, it was generally considered that H5N1 infections in mammals were largely limited to terrestrial carnivores. The foxes and other species have been mentioned, and those mammals that consume or otherwise interact with infected birds. However, the spillover effects that I've just talked about obviously make this a little more complex. And so from a risk perspective, state and territory governments have been doing a lot of work to look at what potential mammals and other species are in Australia. And so even species such as the platypus and the ricali, the native water rat, have been flagged as potential species of concern, as well as the obvious scavengers like the Tasmanian devils, quolls, and also dingoes. Internationally, the Virginia opossum, which lives on the North American continent, is the only known marsupial to have been killed by bird flu. So at this point, we aren't able to extrapolate to marsupials in Australia. And so for this talk, I'm going to focus on the evidence we do have on marine mammals. And as has been kind of touched on so far, largely that is the pinnipeds, the seals and the sea lions. And in Australia, we have several iconic species of concern, which I'll talk through: the Australian sea lion, southern elephant seal, the Australian fur seal, the long-nosed or the New Zealand fur seal. But we also have leopard seals and subantarctic fur seals as occasional visitors to our shores. And all of these species are long-lived, they're slow to reproduce, and they face a number of threats. And so this is just another one on top of that. H5 and other bird flus have also been reported in cetaceans in the Pacific, Atlantic and Arctic oceans. But this data is really hard to interpret, and the impacts are currently less clear. It's not just the H5 bird flu, it's the other bird flus, as Michelle covered. So surveillance for the infection of cetaceans worldwide, the whales and dolphins, has been called for. The good news for the cetaceans is that there hasn't been any evidence of mass mortalities when it comes to species such as dolphins, porpoises or whales, at least for now. But we are concerned that this may just be a result of sampling difficulties or just a lack of understanding of what this means. So that's why for this talk, I'm just going to concentrate on the pinnipeds and for the data that we do have. Next slide, please. So what have the impacts been on marine mammals worldwide? Well, during the 2021 to 2022 Panzoic, so when the H5N1 caused episodic mortality of pinnipeds and cetaceans in Europe and North America, as we saw from that map, we saw it start to spread. But it was only really when it reached the Pacific coast of South America that the virus demonstrated an ability to cause really large-scale mortality in marine animals and marine mammals. In 2022 to 2023, more than 30,000 South American sea lions died as the H5N1 virus spread along the coast of Peru and Chile. And porpoises, dolphins, and others were also affected, but in much smaller numbers. As the virus spread south along the Pacific coast of South America, H5N1 viruses were detected in sea lions at the southern tip of Chile in June 2023. And by early August, the virus was detected for the first time on the Atlantic coast in a sea lion rookery off the southernmost tip of Argentina. Then over the following weeks, the virus spread rapidly northward along Argentina's Atlantic coast, killing hundreds of sea lions along that Argentina shores, eventually reaching Uruguay and southern Brazil. In October 2023, mass mortality occurred in southern elephant seals at Peninsula Valdez in central Patagonia in Argentina, with an estimated death toll surpassing 17,000 individuals and a 95% pup mortality. So you can see not only the devastation to those populations, but also the speed of that spread. And I think Michelle's map showed that very visually, but I think what perhaps it didn't show was the speed of this virus and the ability from this mammal to mammal transition of how fast this can rip through these wild populations. Looking further south into the subantarctic islands, southern elephant seals were also impacted in South Georgia in October 2023, with a brown skua being the first H5 bird flu detection there, as it was here in Australia. It's also spread through penguin, albatross and Antarctic fur seal populations on that island. But it's not until August 2025 that bird flu is thought to have reached Heard Island from the nearby Crozet Islands, which also had the virus. On Heard Island, a scientific paper that was only just released a matter of days before our first detection noted that the female elephant, the elephant seal pups on Heard Island had an average mortality of 76%, and some harems, some of the colonies had a 97%. And it's thought that that was about 13,000 pups in total. And we also think it impacted the Antarctic fur seal colonies. The big but about this one is that there's only been 2 short data trips to Heard Island. So really the data we have, that 76% mortality of pups and the 13,000 elephant seal pups, is really just potentially the tip of the iceberg. It could be much worse. We just don't know because we haven't been back there to test it. Next slide, please. So the Australian species that of most concern, and these are ones that have come up through state and territory analyses in the past couple of years as we've started to get prepared, particularly since 2024 till now. The Australian sea lion is one that's very close to my heart. It's a species I've worked on for more than a decade, getting protections in place. And it's a species that's listed under our federal environment laws as endangered. And this is an endemic species. It's only found in South Australian and Western Australian waters. It's in decline. There's only 12,000 individuals remaining, and the majority of the population is in South Australia. Around 75% of the population is found in South Australia. And really its range, where the first couple of detections of H5 bird flu were found, is smack bang in the middle of that range. And given the scale of devastation to South American colonies, it really concerns me that with only 12,000 individuals left in Australia, that this species is one that is at real risk of extinction if it does transmit and transfer to the local wildlife population. So this is a real species of concern. The Australian fur seal also is listed in South Australian environment laws as rare. In New South Wales biodiversity laws, it's vulnerable. This has a Southern Australian distribution. It isn't listed federally, but it is a species of concern, together with the long-nose fur seal, or which used to be called the New Zealand fur seal. Their numbers aren't as concerning, but it is a species that is potential to cause great transmission across the whole of southern Australia. The southern elephant seal is also listed as vulnerable under the EPBC Act. We've seen internationally the devastating impact H5 bird flu has had on the southern elephant seal. And given they've got breeding populations on Heard Island and also Macquarie Island, it is a species we are concerned about. Obviously, once bird flu is detected in any of these populations, it's much more likely that we will see transmission more broadly in our wildlife population. So as well as our seabirds, our migratory seabirds and other wildlife, we do need to be looking out for sick marine mammals as well, because this will be a really important indicator potentially of broader transmission. Next slide, please. So what do we need to be doing? First of all, we need to urgently invest in conservation for our at-risk species. For some of these species, we still don't have a full or accurate picture of their populations, and this is something we need to correct. Some of these species are found very remotely. They're very spread out along parts of the coast where there isn't high population levels. So we need to get a better idea of their populations now to help inform our response and understand how we can better protect and conserve their populations. But we don't need to wait to invest in conservation efforts. We need to build resilience in the populations now, so that should bird flu hit and transmit to our native wildlife population, we can be best placed to lessen the impact of this deadly virus on these critical populations. Recovery teams that are in place for these species, particularly species like the Australian sea lion, are stacked with experts who know what needs to be done to assist with conservation efforts and where funding can best be spent or directed. They need to be activated now and their advice taken to inform where funding can best be directed. Next slide, please. So in summary, despite the name, mammals do also get bird flu, and they're an important piece of the puzzle as far as transmission is concerned, as it is possible they can spread this virus much further, from seabirds to mammals, mammals to mammals, and back to seabirds. There's a lot more that we need to understand about these pathways that we just don't have the time to fully understand. So we need to be alert and aware with regards to protecting both our wildlife and our livestock and poultry industry. Funding is critical. We need to invest at least $200 million over the next 2 years to build resilience in our most threatened marine species. Thank you.
Yeah, and I love that resounding call. You can see all the thumbs up. Definitely urgent investment is now required. I'm conscious of our time and I want to leave a lot of time for our Q&A. So I'm going to move us on to our last speaker now, Jack Goff. So Jack's here he's the CEO of the Invasive Species Council, and his topic as well is very much about building resilience, how we expand our threat mitigation actions for priority sites and species. Jack, as I said, is the CEO of Invasive Species Council. If it wasn't for Jack's efforts, I think we definitely would not have got that $100 million over the line with the federal government. He was instrumental in that advocacy and is a really experienced campaigner, policy analyst and environmental advocate. And I think what's really poignant about Jack being our last speaker today, he's so passionate about not only the environment and nature side, but that intersection with agriculture as well. So over to you, Jack.
Thanks so much, Kate. Appreciate it. And I don't have slides for everyone. I just want to talk about where we're at and where we're at politically on this issue as well. So a couple of years ago, let's be clear, Australia was ready to be caught with its pants down on bird flu. We had governments that were doing bits and pieces. There was great work going on in Wildlife Health Australia. We had some parts of ag departments that were engaged on the issue, but no environment ministers had been briefed. We had parts of environment departments around the country that were saying this isn't something we really should be concentrating on. And it took a real effort from the community, from media, and from some good people within departments to shift that around. And I think where we can say we are now is that we've got a pretty good biosecurity response happening. And I say pretty good because these things are never perfect, but it's reasonably well resourced. There's good knowledge across the country. There's engagement with different sectors on this issue. And we've done some of that preparatory work in terms of planning for species and habitat impacts. But I do think it's really important that people on this call know when it comes to biosecurity, the focus is almost always industry, not environment. And that's going to be a problem for us. Right now, we've got environment and ag and these things working together. But I can tell you, if you go back to that H5N1 outbreak last year that was talked about right at the start, that was taking over 150 staff every day just from the Victorian department to get on top of responding to a limited H7 response in poultry. We similarly, and over 100 days, there was over 13,000 FTE man hours that went into that. That's going to be an issue here because when this starts to spread at scale, and it, maybe we get away with it this winter, but it looks like it could get established. When it starts to spread, this will be starting to happen all over the place. Alexia showed you those slides. It moved through the South American continent within 6 months. Really quick speed and huge wildlife consequences. So we need to make sure that the focus on wildlife remains, because I can tell you one of the reasons that Donald Trump beat Joe Biden was because the price of eggs tripled due to this particular virus in the US. And that is going to be an impact here as well. And governments find it much easier generally to focus on industry impacts because they're easier to quantify. They tend to be a lot more manageable and a lot more contained. The thing I really want to impress upon everyone here is we're not going to be able to stop this virus spreading. Right. And we also don't know exactly how it's going to impact on wildlife. We can do things to slow that spread, and really important things about not disturbing wildlife colonies, around biosecurity measures that get put in place, and about people being those biosecurity observers are all going to be important for that. But wildlife resilience to this disease is going to be a numbers game. And the way to deal with this numbers game is we need governments to invest seriously in wildlife resilience. And at the moment, unfortunately, the federal government and most state governments funding for on-ground environmental action is going backwards. It went backwards in recent budgets, and that means less work is actually going on the ground to build up that resilience of populations that it may get smashed by this virus. So one of the things we're calling for with, BirdLife and AMCS and Biodiversity Council and the Australian Land Conservation Alliance is this $200 million initial investment in scaled up resilience for wildlife. And that means those actions that can deal with threatened species recovery. And it also means those actions that can deal with broad scale threats to wildlife. Because the healthier the populations are when this virus hits, the better they're going to be able to survive what could be absolutely devastating. And we are talking about the potential for extinction level events in some cases for some wildlife. So this is very serious. I guess in terms of some of the things that are going on with the government at the moment, we have seen some really encouraging investment in this already. So from that initial $100 million package and some further funding that came in the recent budget, we've seen work going on to remove rats, for example, on islands. So up in the Deliverance Island in the Torres Strait, looking at a key resting point for migratory seabirds, making sure that you've removed the rats there so that there's more seabirds surviving. In South Australia, some of the work that Alexia is talking to there with the sea lions around hookworm infection treatment. We're seeing work more generally, for example, in Norfolk Island, controlling starlings and purple swamp hens, which are predators of the native seabirds. There's a lot of these projects going on, but it's not at a scale that responds to the continental level threat and the species level threat that we're seeing. So what I want people to take away from this is serious. This is a really big threat to our environment. This could be one of the worst wildlife disasters that Australia faces. And if we're going to deal with it, that means a biosecurity response, but it also means convincing governments that they need to invest in the resilience of wildlife. Because if they're not doing that, they are not taking the threat of bird flu seriously. We need to be really clear on that. Just investing in biosecurity means that you are failing our wildlife when it comes to the threat of this disease. And the current levels of funding and focus, while really commendable, are nowhere near the scale that's required. So I want people to take away, if you're talking to politicians, if you are a politician, if you're a decision maker, if you see how serious this is, if we don't get scaled up funding into those on-ground efforts that back the work on the ground to build up wildlife resilience at a species level and at a landscape scale, we are not taking this one seriously. There is no stroke of the pen that solves this. The changes to federal environment law or state environment laws, that doesn't solve this issue. What solves it is building up the resilience of wildlife populations to go in hand with the biosecurity work that's going on. And so I'm really pleased that the government has started that. We haven't seen this level of investment previously in a wildlife disease threat before. Preparedness has put Australia in a really good spot. We could have been left with our pants down, but this is only the start of the work that's needed. And if the federal government don't come to the table with serious increased funding at the scale of at least 200 million, then they are not taking seriously the threat of bird flu, and they need to be held to account from that. We also need state governments to invest. So I'll keep it very short there because we're a few minutes over time, but thank you so much, everyone.
So much, Jack. So, and I guess just another closing slide on some of the direction about some of that biosecurity messaging about avoid, record, report there up on the slide. So you've heard from the experts, you've heard our take on the current state of preparedness and what we're facing. So now it's over to you, wonderful attendees at this webinar. I'm going to pass the baton over to Dale because he's much more tech savvy than I am to help sort of pathway out Q&As, and we as a panel are here to help provide our insights to the most burning questions in the webinar this afternoon.
Yeah, great. Thanks very much, Kate, and thanks to all our panelists. That was really informative and inspiring. So I've got the questions here, and what I've done is I've just sorted by the upvoting, and one of the first ones is, how has the disease developed overseas for the past few years, and are birds and mammals developing immunity? So I'm wondering, Michelle, if you might be keen to respond to that one, whether we're seeing any development of immunity in birds or mammals as these diseases evolve.
I think the answer is a combination of we don't really know and maybe yes. So for some species, they've gone out. So gannets, for example, the gannets that have survived the disease have developed these color change in their eye, and so you can actually spot the ones that have been infected and survived it, and those animals have immunity. So we know there is some level of immunity in the population, but there really haven't been any large-scale serosurveys to understand the proportion of individuals that actually have immunity against this. And in cases where we have not seen reoccurring outbreaks in the same species and populations, is that just because we have a different variant of the virus circulating, or is it because those animals are actually immune? Is a bit of a question. And so I think the answer is we're not sure, and it's something that we do need to spend more time clarifying.
Sure, thanks, Michelle. Did anybody else want to comment on that question regarding how the disease has developed overseas? I think the panel's okay. We'll look through. One of the other questions that's very popular is, could South Australian marine mammals be at a greater risk due to the recent algal bloom? And has this compounding effect been addressed here or explored elsewhere? Alexia, I can pass that one to you if you don't mind.
Yeah, absolutely. This is a question I've been asked before, and it's something that I have been concerned about. I mean, I think the issue is with when any mammal is perhaps in poorer shape, they are more susceptible to picking up disease or viruses. And there is some reports of some of the Australian sea lions being skinnier, for want of a better word, due to potential lack of prey. The real issue here is that we just don't have the data on this yet. We're still trying to understand the real impacts of the algal bloom on the marine environment and how that translates to bigger species, higher level species such as the Australian sea lion. But it is possible that the Australian sea lion and other Australian fur seals and long-nosed fur seals are in a poorer condition now, and so that could make them more susceptible to disease. So that is a concern, but we don't have any solid data to, precisely say one way or another.
Okay, sure, thanks. Yeah, Jack, did you want to jump in as well on this one?
Yeah, I just wanted to say on this, I think it's a really important question because we are at a time of intersecting mega threats to the environment. And, we've got the algal bloom down in South Australia, but it was only a few years ago that we had the Black Summer bushfires. We've got other, the potential for Polyphagus shothole borer in Western Australia getting into our trees. We've got climate change having, increasing impacts on the range of wildlife. And I think it's really important that we consider this bird flu threat in that context. This is not something that can be dealt with just by itself. The reason that wildlife are so stressed, I think Kate said it right at the start, is because either this is going to come in when they're at a point of stress and drive further stress to them, or it is going to cause that stress which sees wildlife start to tip into new, categories of threat for them. So I think it's really important, if you're talking to governments, if you're talking to decision makers and engaging on this, that we don't just treat bird flu as bird flu. This is a wave of pain coming for our wildlife in the context of a whole heap of other waves of pain. And that's why we have to have investment in resilience, because, the algal bloom is only one of the things that's going to be turning up for wildlife in Australia.
Yeah, sure. Thanks, Jack. Is there anyone else who wanted to add to those comments?
Dale, I know also just from our wonderful beach nesting birds team, the poor old hoodies have had like the worst season ever, like all of that foam up on the beaches. And again, their breeding success has been quite low in South Australia as well. And I think we haven't really talked about it because we've been so focused on the wildlife, but I will put this in some of my wrapping up comments, is just the impact that this has on community, the devastation for First Nations people, for conservationists, for communities, seeing that marine algal bloom play out in South Australia, just the mental health load that is, making for people has just been terrible. I know our team's been significantly impacted by it, and now they're also facing this looming bird flu threat as well. So it just shows, as we all know, you just can't separate people and nature and economy. Like, we are all interconnected, and as these threats mount up, this is why this action is so desperately needed now.
Sure. Thanks very much, Kate. I wonder if you don't mind, Chantal, if I pass to you on that one, just to consider, particularly with our ranger groups, that BirdLife works very closely with, and how they would be facing this firsthand down in South Australia or the other places where they might be coming across bird flu.
Well, technically, well, I mean, from what I've heard and seen across the board, especially in the Esperance area, where a lot of the rangers are doing, marine coastal surveys and, checking for things. The first few incidences were quite distressing for them. And like Kate says, everything is connected, regardless of, how people think about, one particular topic. It's hard to do that when you have all these other complexities that actually contribute to, the health of country or the health of everything within that as well as ourselves. So, it's quite a distressing thing for the rangers, but we've got to also remember that they are a potential workforce that could be contributing to that and contributing to their healing as well. So it's critical that they are involved.
Yeah, thanks, Chantal. Exactly, and well supported, so that then we're talking about not only wildlife resilience but community resilience and cultural resilience as well when we face a threat like this. So I'll shift to a different question now. I see someone has their hand up. If you can pop your question in the chat. If it doesn't come up, please keep your hand up and I will come to it in a second. But one of the ones I just wanted to look at was a question that's been upvoted a lot, was with the rise of vet clinics deciding not to treat sick or injured wildlife, how will sick birds and wildlife be treated or euthanized going forward? I'm not sure, Triggy, if you're able to comment on that in the wildlife care space.
Look, I think one of the things here is to recognize there's a variety of businesses that are at play here. And I'd really like to note that there have been a number of vet clinics that have and are deciding to see wildlife, where they've done that preparedness planning and really built their biosecurity plans to ensure that they can see birds safely and effectively. And we do know that avian influenza will, once a bird is infected, will cause them to become sick and die fairly rapidly. So we are aware of that. And there have been a number of wildlife care organizations as well have worked hand in glove with their veterinary clinics in areas where they have set up triage processes. We are aware that there are greater needs for personal protective equipment and so forth. And that is something that's certainly continuing to be discussed. But it's certainly just really to reiterate for those organizations and agencies to recognize that they're vets deal with biosecurity every day. They have dogs and cats and other wildlife coming in with other diseases as well. So they have good infection practices, and hopefully that they've also got some plans in place to deal with wildlife that might be infected with bird flu.
Oh, great. Thanks very much, Tiggy. Anybody else want to add to that, Michelle?
I do want to add to that. And so again, in alignment with our messaging, rather than calling a wildlife care, if you see a sick animal, be it bird or marine mammal, the first point of contact is the EAD hotline. And you will be speaking with the veterinarian on the other side, and they will provide advice for what to do. So that is what we need people to do first, rather than taking them to a care or a veterinarian first.
Yeah, absolutely. Thanks, Michelle. And that's, I think, one of the messages that people are recognizing is that avoid record report has been implemented across Australia. Many organizations and agencies are using that language, which is great. And I think Michelle really hits upon a really good point, which is you're then informed on what to do. And that might be leaving the bird in situ, or it might be doing something else, but you're being informed by somebody who has an understanding about the disease and what the next steps really are, and specifically around reporting. And just want to commend all the people who have been reporting through the EAD hotline. That has been a tremendous effort. I think the number of detections, whilst concerning, really highlights the strength of community in reporting on what they're seeing, and it really highlights that we've got really great community involvement already and participating and doing the right thing by avoiding and recording and reporting. So thank you.
Sal, I might just make a comment as well. I think, and not in any way to disagree with what's been said, but I feel, and we've raised this in National Coordination Mechanism, the jurisdictions are approaching this differently. And there have been different on-ground responses to individual cases reported and observed in various jurisdictions. So I feel there is still more work to do to just really strengthen that work and really bring that sort of grassroots community network together. I know a lot of work is being done there, but I think, there are still gaps that need to be filled and strengthened in that regard, just because of as we know, that there is some real time that will be bought from that great community response when well managed and the quarantine measures are properly managed, and that's that avoid message Michelle's been pushing on. But the more that individuals are not allowed to be scavenged or off beaches, it potentially does buy us time, while other arrangements are getting in place. But I still feel, from people on the ground, from what I'm hearing, there's a bit more work to do there.
Sure, thanks, Kate. Anybody want to respond? Or we'll park that one there.
I'll add to that,
Jack.
When this hits, if it hits at scale, and there's still some ifs, there is going to be a lot of despair across the community about what this looks like to see so much wildlife impacted. And I know there are some politicians on this call, and I want you to think about, if you haven't invested at scale in wildlife resilience, if you haven't done everything that is needed to make sure our wildlife are in a better situation for when that occurs, you are going to be held to account by a really despairing public. In the same way that with the Black Summer bushfires, when that occurred, we saw a huge shift in public sentiment on environment issues. I think politicians should take note that this is what is coming. And I think right now, most of the politicians and political parties out there are not preparing for that shift in public sentiment, which could happen very quickly. And I think this wildlife carer one is a real example of that. Could happen very quickly when people start to see the devastation that can occur here. This is going to be very serious. And I do think that politicians aren't taking seriously that more is required than just a biosecurity response.
Yeah, great. Thanks, Jack. Just for reiterating that, and of course we've been working with yourselves and others to try and mobilize that support from government. So changing track slightly now, we've got some questions around if we have an El Nino event approaching the summer with hotter and drier conditions, what is the position on putting out water for wildlife? So I just wanted to comment to get responses maybe on two components there. The first, Michelle and Tiggy, if we feel in summer there have been declines in the spread in other parts of the world, and I'm not sure if that could play a role in how it might spread in our own wildlife, and if a seasonal change could have any impact or not.
I'll let Michelle take this one first.
Sure. Look, I think this is something that we are still disentangling. We know from infectious disease theory that when there is a pandemic that arrives, even if an earlier version of that disease was in epidemic seasonal phases, there is this initial pandemic phase in which seasonality is less important because the whole population is susceptible. So COVID was a great example of this. And I know we don't want to talk about COVID, but when it came in the beginning, it just kind of slammed everyone. It didn't matter about season. I think if you look at the data from Europe, for example, 2,3,4,4-B has been in Europe for almost a decade, and we are starting to see seasonality in those data. And that is being driven by patterns of infection in colonial breeding seabirds in the summer or not, and then sort of this movement through waterfowl in the autumn and winter. It's impossible for us to predict what is actually going to happen in Australia. We always say the only predictable thing about influenza is that it's completely unpredictable. And so what El Nino will do, I don't know. I don't know. Yeah.
No, thanks, Michelle. Yeah, I guess that is very difficult, and particularly for those of us who are scientists, and we sit within that discomfort of there being so much unpredictability. We like things to be more predictable than this, and I think that's one thing we may be going to have to learn to live with, is this level of discomfort around the uncertainty we're facing here. Did anybody else want to add onto that before I move into the second part of that question?
Yeah, I'll just jump.
Oh, you go.
Sorry, Kate.
Alexa?
I'll just jump on that, because I think a lot of my talk was about, that what data we have and what we don't, like around whether, cetaceans can get this, and, yes, they can get bird flus, but not just H5 bird flu, but it's inherently difficult to, sample cetaceans compared until they, beach or wash up as a mortality. So I think, there's been lots of questions I know about whether, how will it affect our marsupials, or how will it affect other animals that we may have. And I think that, as Dale, you said, as scientists, that is challenging for us, but I think it's also something that we have to that's why we have to prepare what we can. And that's why, in my talk, we talked about the most at risk species. Let's try and protect what we can. And at those species that are most at risk, like the Australian sea lion, like the southern elephant seals, let's see what we can do to build resilience in those populations, because they will be a transmitter if that transmission comes to Australia. And so the more that we can deal with those populations and get them as robust as possible to react to this, the better that we will be to minimise impacts on Australia's other mammals, our amazing marsupials and other endemic species. So, there's lots of unknowns, but the scientists are working hard, as Michelle and Tiki said, they're working hard to try and understand this. And even more than a decade in Europe, we don't understand it in the way that we would hope to by now. And I think that's really important to say that we're all basing our comments on the data that is available, but there's many questions that we just can't answer with certainty.
Yeah, great. Thanks very much, Alexa.
Just also make a comment, though, in terms of that habitat condition. Like, we do know what a good wetland system in a healthy condition looks like, and we do not know what environmental watering requirements are required to deliver that. We do know what sound cultural burning practices look like in terms of managing the risk of fire and mega fire in the landscape. So these are things we do know. And I guess that's that resilient story. But also I would say in any sort of unknown sort of emergency type scenario, we do all sorts of scenario planning. That's the susceptibility analysis work that we have in our back pocket. So we understand it's really hard to predict necessarily the exact location, the exact time, but we were not surprised when giant petrels started washing up in Esperance. They travel into that location. We knew Heard Island had been infected. It wasn't a complete out of the box experience. So I think, yes, how this will play out, there is some uncertainty, but I think that should not be precluding us from acting on the things that we do know and the things that we do know have worked elsewhere.
Yes, thanks, Kate. And as we've all said, any of that improved resilience we know can help our wildlife populations ultimately. So I've just got one more that I want to cover here, and that's with regard to the avoid, record, report. What happens after someone has reported a sick or dead bird? Does it get left in situ to then be avoided by others? Who comes to collect it, and what happens to it in the meantime? Maybe just a more practical advice for the listeners out there. Tiggy, maybe you're able to take that one?
Look, I'm happy to take that one. With every emergency animal disease hotline call, there'll be a triage, right? There'll be priority species that we're really worried about. It's concerning and most likely to potentially be positives at this point in time based on the scenario we're seeing. And then other species will be a lower priority. And wildlife do die for a variety of reasons, some very natural. And so, recognizing that the avoid, record, report is trying to triage, focus on the animals that do have priority in terms of potential risk, and then testing those. And so you may be asked to leave the animal in situ, of course, avoid that carcass, or you may be asked to support facilitation of testing, or direct someone to where that carcass is so they can rapidly get to that carcass to do the testing. So there are a variety of different things that can occur when you call that hotline, but just recognizing that your wildlife do die for a variety of reasons, unfortunately some natural, some things that we need to look into. So we, at Wildlife Health Australia, we look into and consider lots of different pathogens that may be causing the disease in wildlife that we want to ensure we understand better so that we can mitigate risk, such as bird flu being one of them, and obviously the most prominent risk at this point in time. So I don't know if that answered fully the question, but yeah, I think call the hotline, work through the process with the person on the end of the phone, and acknowledge that they might not ask you to do anything, but your report is important because it feeds into the information and understanding about the situation in Australia.
Oh, great. Thanks very much, Tiggy. I appreciate that. And I just wanted to comment, I didn't get to the second half of that other question earlier about putting out water. And I think one of the key messages is ensure that that water is hygienic. If you need to change that on every day, change that, disinfect water baths, etc. for your birds and other wildlife. At the moment, we're fairly certain it hasn't established on the mainland. So that kind of practice is still okay, but obviously keep a lookout for other advice that might come from any of our departments if and when the situation changes. And then I think, apart from questions, can I go around the panel and see if anybody has any particular calls we want to put out to the listeners in terms of actions that our sector, members of the general public would like to take in response to bird flu? Any of the panel want to kick that off, Jack?
Yeah, keen to, Dale. Look, there's 1.1 thousand people on this call right now, and if you're worried about bird flu, which hopefully, having listened to this, you are, we need you to write to your local member and ask them, will you back the $200 million call that BirdLife Australia, Australian Marine Conservation Society, Biodiversity Council, Australian Land Conservation Alliance, and the Invasive Species Council are calling for? Because if governments are serious about this, then that is the scale of investment in wildlife resilience that they need to be putting in on top of the biosecurity answer. And if you feel really enthusiastic and you get a response back, probably from someone in the government telling you all about the great biosecurity funding they've put in, go back to them and say, no, we are talking about the wildlife resilience that is needed to make sure our wildlife can cope, because they're doing pretty good stuff on biosecurity. This wildlife resilience funding, if we don't get it, governments aren't taking bird flu seriously. So please take 5 minutes, write to your local member, ask them about it. There's 1.1 thousand people on here. If 1,000 people write tonight their own personal message, that is going to make a big difference to the advocacy all of us are doing behind the scenes.
Yeah, thanks, Jack. That's great. I appreciate that. And Kate, I think I was going to hand over to you to wrap up. Sorry, as we approach 1 minute.
Before we wrap up, I just want to say that there have been a lot of questions in the chat, like advice for veterinarians or I have some chickens, what should I do? There are a lot of resources that are available out there. If you go to your jurisdictional website, like New South Wales avian influenza, for example, there's loads of information there for veterinarians, carers, if you've got backyard poultry, what to do, or even if you have large scale poultry. The Australian Veterinary Association has put out guidelines, animal health committees put out guidelines. There have been some questions about like human cases and physicians. The Australia CDC has guidelines out there. So there is a ton of information that is out there right now. The central location for a lot of information is birdflu.gov.au. So that is a good first place to start. But please use all the resources that the community have been developing for you.
Much, Michelle. Oh, Tiggy, we're right on 5:30. Oh, that's just a love heart. Okay. All right. I'm going to quickly wrap us up because we're right on time now. I think those key messages, healthy wildlife populations stand a better chance of withstanding this virus. And I guess protecting wildlife and their habitat is more important than ever. Everyone on this call, every organisation you represent has a critical role to play here. Get familiar with the tools and science. If you don't have a plan, you should. hopefully this is the wake-up call for everyone. How does this affect my conservation goal? Jack's done a brilliant call out on the 200 mil, so I will only reiterate that is our call. That is minimum investment needed. We needed it as soon as the clock started ticking on the 14th of June. We can't wait for another federal budget cycle. This needs to come now. And lastly, I just want to thank particularly our colleagues at the Biodiversity Council that hustled this together on behalf of all the organisations here, to our wonderful panellists for your knowledge and your insights. And I'm sure we've given you all a lot to think about, but most importantly, act upon. So thank you so much for joining us, and have a terrific evening. Thank you.